Hi, my name is Bladen Kettler, and I'm here to go over an assessment of the head, eyes, ears, nose, mouth, and throat. To start out, I'll go over the eyes. I will first want to talk about the Snellen test. I will not perform that exam here, but I'd like to talk about it. The Snellen eye test is the eye chart you see at every doctor's office. To perform this test, you would ask the patient to stand 20 feet away. It's important that you do measure the distance. They need to be 20 feet. If they wear glasses at home, they need to wear glasses for the exam. And to perform the test, you would ask the patient to cover their eye with something other than their hand so they're not tempted to peek. So an index card or something like that will work. Each eye, cover it, and then read from the top to the bottom of the chart. Do that for both eyes, and then you should be able to calculate what their vision is. So starting out with the eyes, first we'll look at the externals. You want to view the eyelashes, the eyebrows. We want to look at her conjunctiva here. Look down for me. We'll look at the top. Good. The sclera should be white. And now we'll take a closer look at her pupils. We want to take a look at the size of them. And now we want to check and see if they react to light. Look straight ahead for me. So her pupils are equal, round, and reactive to light and accommodation. Now we'll do a visual acuity test. This measures cranial nerve 2. So we'll give the patient an index card, ask her to cover one eye, and then with my hand I will motion and ask her when she sees my hand come into view to say now. Cover one eye for me, please. When you see my hand, say now.
Now.
Good.
Now.
Good.
Now.
Okay. Cover your other eye.
Now.
Good.
Now.
Good.
Now.
Good. Okay, now we'll measure 6 cardinal positions. You can use a pen light or your finger for this. I'll use my pen light. You ask the patient to focus on the tip of your finger or pen light and just ask them to track either or. Ready? Track the tip of my pen light, please. Good. 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 Now I will go over the red reflex. To do the red reflex test, you use the ophthalmoscope. To do this, you would need to dim the light, so we'll do that now. And then you would take your ophthalmoscope, standing about 12 inches away from the patient. You ask the patient to look straight ahead, and we will observe the presence or absence of the red reflex. So look straight ahead for me. So we're looking. And now we'll take a look on the other side. Good, so her red reflex is there. Now we'll move on to the ears. We'll start out with looking at the external of the ears, noting symmetry and position. We can apply pressure to the auricle. Here, ask if she feels any pain.
No.
No? Okay. Now we'll take a closer look at her ear canal and take a view at the tympanic membrane. So going in, looking at the tympanic membrane, it should be pearl gray in color, should be intact. You want to make sure you don't see any inflammation or that it's ruptured. Take a look at the other side here. So hers look good. Now we'll go over the whisper test. To do the whisper test, you'll ask the patient to cover one ear, and on their opposite side, you'll whisper 3 words, ask them to repeat them for you. So we'll do that now. If you'll cover your left ear, please. Okay, I'll whisper 3 words.
ABC.
Okay, we'll go and move to the other side.
1, 2, 3.
Okay, good. Now we'll go over the nose, mouth, and throat. So for the nose, we'll look at the externals, symmetric. We'll ask the patient to look up for us. Good. We'll take a look at the septum, make sure that it's not deviated. We'll want to check patency of the nose, so we'll cover one side and ask the patient to breathe for us. Breathe. Good. Check the other side. Breathe. Good. Now we want to take a look inside the nares. No, close your mouth for me. Alright, so look inside the nose. Make sure you look at the membranes. Make sure they're not irritated or anything like that. Take a closer look at the septum inside too. It doesn't appear deviated. We'll take a look at the mouth now. So ask the patient to open up for us. Take a look at the teeth. Everything looks normal, and the gums, the tongue. You can say ah.
Ah.
I'll take a look at the uvula. Good. So you can turn all the way out for me. Okay. Good. Also want to take a look at the tonsils. Say out for me. Good. It appears our tonsils have been removed. If they weren't removed, you could measure them using a 1 to 4 scale. 4 being closest to midline and 1 being towards the lateral aspect. Now we'll take a look at the sinuses real quick. So we want to apply pressure to the maxillary and the frontal sinuses. Ask if the patient feels any pain. Do you feel any pain?
No.
No? Any pain?
No.
No? Okay, good. And that concludes the assessment for the head, eyes, ears, nose, mouth, and throat. Thank you.